Good afternoon, everyone, and welcome back to week 4 of Clearwater's Healthcare AI Summer Series. Thank you for joining us. I'm Monica Pastor, Senior Events Marketing Manager here at Clearwater, and I'll be your host for today's session. Over the past 3 weeks, we've explored the evolving landscape of artificial intelligence in healthcare, from the regulatory environment and governance expectations to the rapidly changing threat landscape created by AI. Throughout each discussion, one message has become increasingly clear. Implementing AI is no longer the biggest challenge. Governing it effectively is. Today's session shifts the conversation from strategy to execution. Our topic is From Commitment to Execution, Operationalizing AI Governance in Healthcare. Many healthcare organizations have already recognized the importance of AI governance. They've established committees, drafted policies, or started conversations around responsible AI. But the question many leaders are asking now is, what does operational AI governance actually look like? How do you move beyond good intentions and build governance that becomes part of everyday operations? How do you create an AI inventory of systems when AI is already embedded in the technologies you use every day? How do you prioritize risk, monitor AI after deployment, integrate governance into procurement and change management, and ensure accountability across the organization without creating unnecessary bureaucracy? These are all practical questions healthcare leaders are facing today as AI adoption accelerates. Before we begin today's discussion, I'd like to briefly cover a few housekeeping items so we're all comfortable with the agenda for today. All attendees are in listen-only mode and will remain on mute and off camera. Please submit any questions that you have using the Q&A feature during the presentation, and we'll reserve time towards the end of the session to answer those questions. A copy of today's slide deck, blogs, and articles relevant to today's session can be found in your Resources tab on your Zoom navigation bar. Towards the end of the session, an attendance certificate will also pop up that you can download for attending today. This webinar is being recorded and will be made available to all registrants following today's session. And lastly, when the Q&A section starts towards the end, a brief feedback poll will prompt up, and we'd really appreciate your quick feedback on what you found of value today so we can make sure that these sessions are valuable to you and worth your time. All right, during today's discussion, we'll explore how organizations can build governance programs that are scalable, sustainable, and aligned with existing enterprise risk, cybersecurity, compliance, quality, and clinical operations. You'll hear practical guidance on establishing governance structures, creating AI inventories, implementing risk tiering, monitoring AI over time, and embedding governance into the operational workflows organizations already rely on. By the end of today's session, you'll have a clearer understanding of what mature AI governance looks like in practice and the foundational steps your organization can begin taking immediately. So I'm pleased to introduce our speakers. Joining us first is Dave Bailey, Vice President of Consulting Solutions and Strategy here at Clearwater. Dave works with healthcare organizations across the country to help them navigate complex cybersecurity, resilience, and enterprise risk challenges. He brings extensive experience helping executive teams translate governance strategies into operational frameworks that can scale across the enterprise. Today, he'll share practical frameworks for building AI governance that extends well beyond policy and becomes an ongoing operational discipline. So welcome, Dave. We're also excited to welcome Cate Ciccolone, Associate Director of Commercial Health IT Advisory at Guidehouse. Cate advises healthcare organizations on digital transformation, health IT strategy, and emerging technologies, helping organizations navigate the operational realities of implementing innovation while balancing regulatory, clinical, and organizational priorities. Her experience provides valuable insight into how healthcare leaders can successfully integrate AI governance into existing business technology operations. So Dave and Cate, thank you for being here today. Let's get started. Dave, I'll turn it over to you to start today's discussion.
Monica, thanks so much, and good morning or good afternoon to everyone. I have been looking forward to this conversation ever since Clearwater sat down and planned out how we would deliver an AI summit that certainly we want folks would want to hear about what are the challenges that exist today. I'm excited to have Cate join this conversation. I had the pleasure a while back, meeting Cate and working together. And it's awesome knowing that our organizations, both Clearwater and Guidehouse, are here to serve and support uh, the healthcare mission, and our clients have all of the same questions and challenges. They're all at different varying degrees of scale. And this conversation of artificial intelligence, I think we can all say, has gone from, a buzzword maybe a year ago to, man, is this really happening, to, oh, it's happening, to, hey, now we need to do the maybe catch up or do the right things and implement governance and good risk management around it. And how do we do that without stifling innovation, without meeting the demands that we know all of the technology vendors are driving towards AI capabilities. And ultimately, when you finally sit down, maybe pause and look at the forest amongst the trees, you find that this can be very overwhelming. So, one of the things that we want to do today, Cate and I are going to have a discussion about, what's breaking down, what is the problem we're trying to solve, and then, talk to you about four pillars that we think, once governance is established, and that's also an interesting, conversation to have, is like, what does it mean? What are the things that you need to do to be able to ultimately manage risk throughout AI lifecycle? I know and have been asked so many times by organizations and conversations around AI. I think ultimately artificial intelligence comes down to trust. And if we're going to trust it, our patients are going to trust it, um, people, partners, vendors, and we're going to effectively, use artificial intelligence inside of clinical operations and inside of our business practices. You have to be able to trust it. So governance helps you do that. And we're going to start out today by saying that a you have a governance framework, but what you may not have is governance. So, a framework on paper and governance in practice, they are two very different things. One lives in a document, the other lives in what happens the Tuesday after the AI you've already implemented now updates its model, and now is in production. So what happens there? I go a step further, just to set the context. A framework tells you what should happen. Governance is what tells you what did happen, who approved it, who's watching it, who gets called when there's an incident. I think that's, most importantly, we can um evaluate what AI we're going to use, but what happens once it's in production, when something goes wrong. And I think these are things that, why we say operational governance is so important. Uh, I believe, and I know this may oversimplify the problem, but governance is the start line. If you establish governance, you're really at the start line. So, um, most organizations that we work with, they either have already established the governance part. They have committees, they have stakeholders. Some have recognized that they need it, and maybe don't have it, and are starting to build those practices. And I think what everyone can recognize is that AI and innovation is moving faster than most traditional governance, programs and practices they can keep up with. So, once again, we're going to discuss today why this is breaking down, and Cate and I are going to dive into four key pillars that are necessary to have effective governance. So very much looking forward. And before Cate and I get into the discussion, I want to talk about three things that maybe will resonate with you and what you're facing inside of your organizations. Once again, what problem are we trying to solve? Why is operational governance so important? The first one is, no one is watching. And, we talk about shadow AI. We may not even know what AI is in the organization. We may have approved artificial intelligence and have it in operation, but no one's actually watching who's doing what with it, or if there's a problem, or if it's actually doing what we expect it to do. And I think ultimately, a highlight that we will hit on today is that, certainly everyone owns that AI risk, um, but operational governance is going to help you understand exactly who's accountable and how to address, the ongoing, life cycle risk management. The second thing is, do you have processes that only approve once, they run forever? You assess it at intake, but as we know, artificial intelligence is constantly changing. So, how do we implement the things that help us keep up with all of the changes, understand the risks, and ensure that ultimately we can continue to trust that artificial intelligence? And the last one I want to point out, policies don't touch production. They're while it is important and extremely important to have good standards and good policies that guide your practices, they can't be paper. The inventory, if your inventory is only in a document that no one updates, or you're not monitoring to ensure you have the practices to keep that inventory up to date, you're just not going to know what your overall risk exposure is, and what ultimately what the AI attack surface, really is which is what we're learning. I think the news over the last even month has been dominated by frontier AI models, and what's happening with the threat out there. So, once again, we're trying to use artificial intelligence for the good to help us, ultimately, be able to provide, the best care and the best service and value for our businesses, um, just as fast as the bad guys are trying to develop capabilities to attack us. So, once again, in governance, and in risk, you can't protect, or you can't manage or govern, what you don't know. So, let's uh let's move into, what really the meat of our discussion today is, and talk about four pillars of AI oversight. First one that we're going to talk about is continuous inventory and risk tiering. Really looking forward to this conversation with Cate about risk tiering and knowing what's in your environment. Second pillar, on monitoring and drift detection. This is about setting a baseline, and how do you know, if you've gone away from the baseline, and then ultimately, what happens if it does drift? What happens when there's an incident? Do you have the practices in place? Human in the loop controls really important. While AI may move at machine speed, we're certainly not, just looking to deploy artificial intelligence in some autonomous state. There still needs to be human in the loop controls. So we'll take a look at what that looks like. And then lastly, about, metrics, reporting, and cadence. I think most of us know, if leaders can't see it and don't understand the metric, then nothing gets fixed. So it's extremely important, for us to be able to, at least have these four pillars as we look to the type of practices that we are going to implement, to have effective operational governance. So, hey, let's dive into the inventory. And, Cate, certainly an absolute pleasure for you to join us today. And I'm going to kick it off with a question, for you. When we talk about continuous inventory and risk tiering, when organizations are just getting started, what actually has to happen first?
Well, Dave, the biggest misconception I run into is that organizations think they need a complete operating model before they can govern AI. In reality, governance should start before you have all the answers. The first move is ownership. AI touches clinical operations, compliance, cybersecurity, privacy, enterprise risk, revenue cycle, and quality. Without a named executive sponsor, governance becomes everyone's job, which means it's nobody's job. In healthcare specifically, there's real confusion whether AI governance belongs with IT or digital transformation, innovation, clinical informatics, or compliance. The honest answer, it belongs across all of them. but someone has to own convening those stakeholders. The second move is a charter, and it can be one page. It should answer three questions: what falls under AI governance, who has decision authority, and how decisions get escalated. I say this because of a pattern I consistently see in healthcare is AI pilots popping up independently across departments. We've all experienced this. Marketing is piloting a Gen AI solution. Revenue cycle bought a denial prediction tool. Clinical operations is testing an ambient documentation product. None of those teams think they're creating enterprise risk, but collectively, they absolutely are.
Yeah, no, I mean, you bring up such a good point with ownership and executive sponsor and understanding. I have been asked many times by our clients, like, where should AI governance sit? I don't believe there is a right answer. The right answer is it needs to live where the right stakeholders are. And I know today, some may try to take that burden on in existing governance, structures, cybersecurity and compliance, enterprise risk. What I will say is I think in the beginning, artificial intelligence will dominate that particular topic, and you certainly don't want to minimize or forego the other governance and oversight activities that an organization has. So, it's extremely important. It really doesn't matter where it sits, as long as you've got uh ownership and accountability defined, and you don't need to eat the elephant all at once, as we like to say. It can be simple, make it simple, and then expand it as it goes. I think one of the things that you and I talked about as we prepared for this is, if it we've got to leave folks with what the takeaways are. So, what practically, as we look at this, what can someone do on Monday after this session? So,
Well, first and foremost, name an executive sponsor. Stand up that AI governance steering committee and draft that one-page charter. And connect AI governance reporting into whatever enterprise risk committee that already exists. Don't build a parallel structure. And also use technology from day one. It could be an intake portal, a ServiceNow or SharePoint workflow, some kind of formal governance platform. But above all, do not run this by email. Email-based governance is where accountability goes to die.
yeah, no, it's a really good point. You don't have to start completely with a blank sheet of paper. But having the structure in place is extremely important. And the stakeholders, I think, are the biggest things. So, you know, I I I know, and when you look at how are folks using AI today, what are really the challenges? I think a lot of it comes down to use cases. You mentioned about all of the pilot projects popping up, and folks wanting to use AI to innovate and to make, their processes more effective. Um, you know, what's an important control that none of all of this fails? I believe if what control do you need to have in place, and where should folks point their energy today, or this doesn't get off the ground?
Absolutely, you know, I have to say emphatically, it's the inventory. So every other capability depends on it. You can't assess risk, monitor performance, conduct an audit, review a vendor, or investigate an incident if you don't know the AI exists in the first place. And here's the healthcare specific trap: organizations think they have a handful of AI tools. Then they discover AI embedded in Epic within Oracle Health, maybe in their radiology and imaging platforms, in revenue cycle tools, contact center software, Microsoft Copilot, even in your own security products. The inventory also should not just capture tool names. It should include intended use, clinical impact, the business owner, the technical owner, what data it touches, the vendor, and the risk tier. Think of this as a keystone control. Everything downstream depends on knowing what you're actually running, what you bought, what's embedded in the tools you already own, and what shadow IT is happening quietly in a browser tab. I'd say start with three sources: procurement contracts, your EHR vendor AI roadmap and feature list, and an organizational amnesty survey. Just ask every department, what AI are you using, testing, piloting, or considering? No blame, just visibility. Then connect that inventory to systems you already have, your CMDB, your GRC platform, vendor risk management, maybe a BAA workflow or change management, security monitoring, incident management. But don't build a new spreadsheet, extend what already exists. And honestly, don't expect it to be perfect on day one. The goal is a living inventory that gets more complete and more operational over time, the same way you'd treat an application inventory or a CMDB. The healthcare pain points I see most often here: vendors will turn on AI features without telling anyone. Departments might purchase AI enabled tools outside of enterprise IT. A routine software upgrade quietly introduces Gen AI capability, and there's no single source of truth for what's approved versus what's just running. If your inventory exists, it's often a static spreadsheet or a document, not something operational. It's rarely connected to a CMDB, your vendor risk, BAA workflows, or incident management that the rest of your organization already relies on.
Yeah, I think if we're all being honest with ourselves, AI inventory living in an operational system versus a spreadsheet, really comes down to is someone actually updating the spreadsheet, and are there all the practices and policies uh, around that? One of the things that I think is so important as you stand up your governance and understand, tiering. We all talk about tiering, but tiering is important because you're not going to be able to do everything the same, and you've got to understand either what's more important, or what are the things that you need to do, maybe because of a security compliance or regulatory thing. So I think tiering is extremely important in this process. So what are your thoughts on that?
I 100% agree. And to add to that, keep tiering simple. I've seen healthcare governance groups build 20-page risk matrices that slow every single project to a crawl. And one question does most of the work: how close is this AI to patient care, clinical, reimbursement, access, or a safety related decision? And what happens if it's wrong? Three tiers is enough to start. High risk. Some examples would be sepsis prediction, diagnostic support, prior authorization decisions, coding recommendations, clinical triage, anything that substantially influences care, access, safety, or payment. Then moving to a medium risk tier. This could be ambient documentation, clinical summarization, operational forecasting, utilization management support, anything that informs a human decision maker rather than making the call outright. And then lastly, your low risk tier. This could be meeting notes, HR assistance, or back office productivity. An ambient scribe and a sepsis predictor are not the same risk, and they shouldn't get the same review depth, the same documentation burden, or the same monitoring frequency. So scale all of that to risk tier, or governance won't scale at all. Teams will just go around it.
Yeah, I think that's some of the biggest things that we have seen. I can even speak for Clearwater's use and adoption of artificial intelligence. Our governance, council and committee worked extremely hard in trying to set, tiers and stages for us to not stifle innovation, because that's the last thing anybody wants to do. And you can put the right guardrails in place, for things that certainly, when you're protecting, patient lives, and you're impacting patient lives, those things should go through effective and more scrutinous than doing something that helps, write better emails, as the example. So I think it's important for folks to grasp that concept in the development of their governance practices, that understanding your risk tolerance and putting in practices that are appropriate to the right type of AI that you're trying to implement will really, remove some of the roadblocks that may look like all that governance is doing is slowing down innovation. So that's extremely important. Um, hey, let's move into the second pillar, and this one I think is extremely important as far as once you get to the start line. So hey, we've got the governance, we've got the tiering, we've assessed the risk, all the stakeholders are involved and aware. Um, Now we have it in operation. Um, so Kate, once something's approved, what should organizations be doing to continue to watch?
Well, Dave, this is where healthcare AI governance is the least mature today. Approval isn't the finish line. It's the beginning of the monitoring obligation. Too many organizations will evaluate a model once and it'll assume it'll perform the same way forever. That assumption is very dangerous because healthcare environments can constantly change under the model. There are workflow changes, documentation changes, population changes, vendor updates, regulatory changes, new data sources, or maybe clinical adoption changes. Uptime is not monitoring, drift is. A system can be technically available and still be clinically unsafe, biased, degrading, drifting, or no longer aligned with its intended use. So, organizations should continuously monitor accuracy against the original baseline, drift. So, we're talking data drift, concept drift, degrading performance, workflow drift, bias across relevant patient subgroups rather than just at procurement, adoption, meaning are people actually using it and whether it's being used as approved. Adoption. If staff are using tools in ways nobody envisioned during a review, that's a new risk that needs reassessing, not a workaround to quietly tolerate. And safety events. Nearly every near miss should get connected back to the model, workflow, vendor, or governance decision that contributed to it.
Yeah, I think this distinction between uptime and drift is really worth driving home at this stage, because as we always, if you look at it from the traditional CISO perspective, they don't walk into a board level discussion or communicate the security just based upon saying the system is up and running, right? It's an evaluation. It's something that you've done to ensure that the system is performing the way that you expect it to perform. Ultimately, that you trust it, and I think this is it is not a easy problem to solve. It is not a hard problem to solve, but it is something that is going to take concerted effort for organizations to build the right people, process, and technology. I don't believe this is all people driven here. I mean, we are going to have to leverage some of the great innovation in AI monitoring and help in this, because this is, much like I would tell someone, don't build your own security operations center with a small staff. Leave it to folks that can put the right time, money, and resources in. This is the same thing with artificial intelligence monitoring. It's going to have to be a balance between people, process, and technology. So as organizations, start to turn the AI system on, use the AI system, what does all this look like before you go live, and what should would be looking at from establishing that baseline?
Well, define the baseline before the model runs. What does normal output, accuracy, latency, and error rate look like? Decide who receives the monitoring reports, what thresholds trigger escalation, what changes require a re-review, and whether the vendor or health system owns each monitoring activity. And very important, put this in the contract not just in your intake form. At procurement, ask how the tool was tested and validated, whether the vendor will tune or validate on a sample that actually looks like your population. How was bias evaluated? How model updates will get communicated? And who's responsible for investigation and remediation if something does go wrong? Monitoring responsibility should be an explicit contract term. Don't let it be an assumption. The contract is genuinely where monitoring lives or dies. This is also a place where technology can help govern technology. Governance platforms can track inventory status, review schedules, vendor updates, risk scores, drift indicators, and escalation history automatically. But tooling doesn't replace accountability. It just helps you find issues faster. Clinical judgment, compliance oversight, and executive accountability stay human responsibilities no matter how good the dashboard is.
Yeah, and AI doesn't help the traditional problems that we, generally have seen all throughout trying to make, IT and systems and technology secure and compliant. I think we already, as those of us that have been, in security compliance roles know that, if security or compliance haven't reviewed the system and the contract signed, like you've lost your leverage, you've lost the ability to really understand the risk that may be introduced. That also translates, into the operation. Once the system is plugged in, it's in production, you're using it, you have to be able to have the people, process, and technology that enables you to monitor that as you go forward. So, before we dive into pillar three, just want to do a heading check here. We've gone through half of the pillars. It's important, to note that we've got to know and identify what we need to protect. I think that's really important. And we have to be able, to continuously, monitor that. It These are things that are foundational uh, to where we move. You have to have those in place before you get to pillar three. So let's dive into that, which is the human in the loop controls. So let's talk about who's actually in the room for these decisions, who's usually missing, and what are you seeing across the healthcare ecosystem with your clients?
Well, Dave, healthcare is uniquely hard here because AI touches both operational decisions and patient outcomes at the same time. Most governance committees have the obvious seats filled: executive leadership, a CIO or CTO, information security. We have privacy, compliance, legal, clinical leadership, quality and safety, or operations and procurement. But most groups are often missing the ones that matter most. Frontline clinicians are the first gap. Executives will evaluate AI on capability, but clinicians evaluate it on workflow. I've watched technically excellent tools fail for no reason other than adding 5 clicks to something a nurse does 200 times in a shift. Procurement is the second gap. For most organizations, procurement is genuinely where AI enters the building. And if procurement isn't at the governance table, oversight is starting too late by definition. And the third, quieter gap is patient representation. You're deploying patient facing chatbots, AI powered scheduling, AI assisted communications, digital navigation tools. Patients have a real stake in how that's governed, and they're almost never in the room when it's decided.
Yeah, I think the clinician gap and the understanding of the patient goes extremely hits really home with the foundation of trust and why we are doing this and putting these practices into place. The clinician has to be able to trust what's happening, has to be able to use technology that is going to make their workflow and lives easier. And the patient ultimately, I think we're probably in a little bit of a transition. It'd be curious to know how many people over the last year, what their thoughts on artificial intelligence were a year ago to where it is today. I love getting into the conversations about, will you get in the Waymo, right? Will you get in the self-drive, the will you get in the car that doesn't have a driver in the seat and let it take you somewhere? It's no different with the patient. The health system that I go to every time I see my doctor, they'll let me know, hey, we're using artificial intelligence to record this visit, and are you okay with that? And I think it's important for um us to be able to, if our clinicians trust it, if our leadership trusts it, if our messaging is transparent. I think transparency is big in this conversation as well. Making sure that everyone knows, hey, we've got a process in place. We evaluate this, we understand, and we trust that the AI is doing exactly what we think it is. So they are what it is supposed to do. So when human is technically, quote, in the loop, how do you know that's real and not just a checkbox?
This is the line I would want every compliance officer on this call to remember. A disclaimer is not an override. A human reviewer only reduces risk if they have the right expertise, enough time, enough context, and critically, real authority to stop the workflow. I've seen organizations that technically have a human in the loop, but the process creates automation bias. When the reviewer effectively rubber stamps because they don't have the standing or the information to push back. So for every high impact use case, name the reviewer. Write down who can pause or roll back the model. Log every override because regulators will ask. And we assumed someone would have said something does not hold up under audit.
Yeah, and what I hope and I see out of a as time goes on over the last several months in artificial intelligence, you're starting to see where regulatory bodies, organizations that represent public-private partnerships are starting to, and even organizations that represent, large subsections of the healthcare sector, you know, putting out guidance, putting out information about what good looks like, about transparency, about what organizations should be doing. And this process is not going to work if it's a check the box. I think this is where it comes down to understanding people, process, technology, and know that, we may need technology to support that reviewer, to ensure that they have, the right, whether it's skills, whether it's, knowledge, information, but, the right information in front of them to be able to validate and, make that decision. And once again, I don't mean to beat a dead horse on trust, but, the reviewer has to be able to trust everything they're seeing in order to know that there's a problem, there's not a problem. And then if there is a problem, what do you do about it? And I think those are things that are extremely important for us to be able to do. And so with that said, what does a genuinely good review process look like, and what actually needs to be documented?
A mature healthcare governance process should resemble a clinical review process. Consistent criteria, consistent documentation, consistent decision making. Every AI solution gets evaluated against the same core categories, but the depth of the review scales with risk. So those categories include clinical safety. Could patient harm occur? We have privacy. What PHI is accessed? Security. How does the data move? Compliance. What regulations apply? Operational impact. How does the workflow change? Monitoring. How will success be measured? Explainability. Can users understand when and how to trust a remediation? And lastly, that human in the loop accountability. Who reviews the output and who can override it or pause or roll back the tool? Every review should end in one of three outcomes: approved, approved with conditions, or declined. And most importantly, document the rationale. Future stakeholders need to understand what was reviewed, who participated, why the decision was made, and when it should be revisited. The intended use statement and the model card should stay part of the permanent record because they become the baseline of your future monitoring and audits get measured against. The healthcare pain point I'd flag here is treating procurement approval as the finish line. Again, that's the start of accountability. A checkbox is not oversight. Human in the loop only works if authority, escalation, and documentation are real. And that documentation should cover the decision, the rationale, required conditions, the review date, monitoring expectations, the business and technical owners, the escalation path, and validation evidence behind it.
Yeah, I think if I would ask, those listening that if you want to take one thing away from, this entire pillar, I think having a documented rationale about the human in the loop expectation is extremely important. I also think that if you build the right governance foundation, part of that governance foundation is going to be able to document what that review is. Because as we all know, 2 years from now, if something were to happen, change in personnel, you're going to want to be able to have that record and an understanding of what human in the loop meant for that artificial intelligence, especially if you have to deal with, with some type of cybersecurity incident or regulatory inquiry or whatever it is. And ultimately that process helps build trust and transparency. And I think, once again, cannot foot stomp trust and transparency enough in this conversation and cannot foot stomp that this is not a checkbox exercise. Like organizations need to understand and take, I think, very focused energy and effort on what does it mean for them to manage artificial intelligence once it's in operation. I think that's extremely important. And I know that most folks are struggling just to get to the start line, and it's like, okay, you're at the start line now, the race is running, and you want to make sure that that you're in the best position you possibly can be in to minimize risk, minimize impact. And I think this is an extremely important part of how we as the human in the loop can contribute in this monitoring and operational governance process. So let's hit the last pillar here. Uh, typically of I think always an interesting one when it comes to how do we measure ourselves, what are we measuring, and how do we communicate, what all this means and make it digestible to boards and make it digestible to leaders and decision makers. I think if you were if a client were to come to you today and say, hey, we've got this governance thing stood up, but we're really starting from zero when it comes to, or we need to stand up this governance and we're starting from zero. um what should we be building in order to ensure that we can document and report out what we're doing?
So I would say skip the 50-page policy. You build operational controls first. You know, there's three that come to mind. The first control is an intake process. One front door, whether someone wants to build, buy, or pilot AI. The second is an acceptable use policy because your employees are already using ChatGPT, Claude, Gemini, Copilot with or without your organization's guidance. And the third is a procurement model card. The vendor should be able to explain its intended use, validation methodology, limitations, performance results, bias testing, update process, monitoring capabilities before the contract is signed. If a vendor can't answer those questions, Dave, that in itself is information.
Yeah, I think when you look at kind of the foundational practices when it comes to, having that knowledge and then being able to capture, what the answers are and be able to report out on that and have leaders make good decisions when it comes to artificial intelligence risk. I think those are key. I think this is another thing that we constantly see as we are talking with our clients and others about artificial intelligence is how do you keep this from becoming a side project? And it's disconnected. Like what AI, evaluation, operation monitoring risk, shouldn't be a side project. So how do you keep it from becoming one?
Well, the best AI governance programs don't create an entirely new organizational structure. They leverage the governance you already have. Healthcare organizations already run quality committees, safety committees, risk committees. You've change management, vendor management, security review boards, maybe a clinical informatics governance. AI should be another lens inside those existing structures and not a parallel committee competing for the same people's time. Concretely, procurement should be a government governance checkpoint so AI gets identified before the contracts are signed. Vendor risk management should assess AI specific concerns along the security compliance review it's already doing. Change management should account for AI updates and new releases. And AI related incidents should flow through the same quality, patient safety, and incident management processes that already exist, not a separate track. Say an ambient documentation tool starts introducing clinical documentation errors after a vendor update. That should go through your existing patient safety process, your existing incident response review, and existing root cause analysis. Governance should enhance what's already there, not duplicate it.
What so I think ultimately when it comes down to, I hate to use a term like brass tacks and what does leadership really actually need to see? What can you advise, what would you advise governance groups to make sure that they can provide to leadership?
Track 5 indicators in the same language that your board already uses for every other risk: inventory completeness, re-tiering activity, drift incidents, override rate, and escalation time. And Dave, for healthcare specifically, I'd also add the number of tools by risk tier, tools with an overdue review, tools without a documented owner or monitoring plan, and any AI related incidents or patient safety events tied to an AI enabled workflow. Set a cadence and hold to it: monthly for high risk AI, quarterly for medium risk, periodic attestation for low risk, and immediate escalation for drift safety events or major vendor updates, regardless of the tier. And use the same report format every cycle: what changed, what risks increased, what needs a decision, what's overdue, and what needs executive attention. And the most practical thing you can do is structurally align this to your existing systems development lifecycle. Add an AI governance checkpoint at each phase you already have. Intake at ideation, a model card required at requirements, privacy, security, and clinical workflow review at design, validation and bias testing before deployment, drift monitoring during operations, a re-review triggered by a vendor update, a scope change or retraining, and a disablement plan when a tool is retired. You're not creating a new process. You're adding checkpoints to the ones you already run.
Yeah, I think if anybody can walk out of this is hopefully the understanding. And I think when you frame it that way, Kate, and you say, hey, these are things, this is how you can help have this a ongoing AI dialogue and the things that you can report out, it becomes real. Like it's once you put it down on paper, it becomes real. You can manage it, you can report out on it, and most importantly, leadership can make decisions. So let's as we close out, the four pillars. I know we've talked about a lot of different aspects, hopefully under four key areas. Let's look at how we can phase this approach in, and how does somebody go about implementing the four pillars. So let's say someone's listening to this and they're feeling that they're way behind. Where do they actually start?
Well, the good news, Dave, you don't need to have all 4 pillars mature on day 1. I would say, day 0 to day 90, catalog every AI asset you have that you find and assign initial risk tiers. That's it. That's the whole phase. Months 3 to 6, build out drift thresholds and define escalation paths so pillar 2 has real teeth. Months 6 to 12, connect what you've built with your existing GRC and vendor risk processes so this stops living as that side project. And after that, it's ongoing. Re-tier as things change, review your metrics, report to leadership on a real cadence. It's sequential on purpose. Nobody starts at maturity, and trying to build all 4 pillars at once is usually how organizations end up finishing none of them.
Yeah, I think the sequencing is extremely important. I go back to you can't protect and perform without knowing what it is. So the inventory and the baseline is important. Building in the practices, like what does good look like, to be able to monitor and understand that your AI is performing the way that you expect it to. And ultimately, as we've discussed today, is don't reinvent the wheel. Like, integration into existing practices is extremely beneficial, and something that may make something that looks extremely challenging and daunting a little easier, because it's really, no different in practice, based upon what you're currently doing today with software development lifecycle. And as in anything, measure it, assess where you are, and continually make process improvement. So would like to move in, so we've talked about the pillars, we've talked about the path, and ultimately what are the four things that we can leave with you today. I I think, if I can leave anything, hopefully you've taken away the governance and oversight. They're really not the same thing. They're a partnership. You need to be able to build both. Um, Once you have governance, it's how you go about um, doing the oversight. Intake is the starting line, not the finish line. Your AI keeps changing after you approve it. Name the owner. If no one is accountable, no one's watching. Like, it just comes down to understanding the accountability, and always start where where the risk is highest. You don't need to have and mature every pillar all at once.
And Dave, I'd add one additional closing thought. The organizations that succeed here are not the ones that build the biggest AI governance office. They're the ones making AI oversight part of how they already manage risk. Governance starts with policy, but it becomes real through inventory, ownership, monitoring, escalation, reporting, and continuous improvement. This was never about slowing innovation down. It's about building enough trust, transparency, and operational discipline that healthcare can scale AI safely for patients, clinicians, and the organization holding it all together.
Yeah, and I'll close out this part before we open it up for some questions and answers. And I hope potentially that if Kate and I did our jobs, that maybe the topic of governance lands a little differently than it did before. You started the presentation today. I think if you have a framework and you have a committee, and you're at that point, doesn't necessarily mean that what you have is governance. And the difference between those things isn't the charter or the policy document. It's a live inventory. It's a current and effective monitoring plan. It's the human in the loop reviewers. It's the people process technology, and it's the report that ultimately gets to leadership on a cadence that they can act on and make decisions. So, this while it may sound daunting, it's doable, it's necessary. Artificial intelligence is not something that we see on the horizon. As we all know, it's here. And if you haven't gotten started yet, we would ask everyone to start on Monday. I'll give you the weekend. We can rest till the weekend. So start on Monday. So
All right. Thank you, Dave and Cate. We're now opening up to question time. If you have any questions, please put them in the Q&A right now. We do have one question that came in, Dave and Cate. Everything here assumes a big health system with a GRC platform already. What does good enough governance look like for a small or rural hospital with one compliance person wearing 5 hats?
this is a great question, and what I would always like to tell folks, and when you define what good is, um, you don't need to no one is going to tell you exactly, or there's nothing out there that says that you have to have the enterprise GRC platform, or you have to have volumes of documentation. um, what you need are practices that are effective for you, and tools and processes that enable you to effectively do your job. As we like to say, that's why you know, there's this reasonable and appropriateness to controls. And what I would say to someone with small teams is utilize what's out there in trusted spaces. There's a lot of great guidance that's coming out of the Health Sector Coordination Council, out of CHI, out of government publications. NIST has a lot of great information. A lot of the things that you look at around governance frameworks, they come with playbooks, or they come with, here are the things that you can do to say that you're doing those things. So I would just ask everyone to, you know, nothing says that you have to go out and do the enterprise approach if you're not enterprise. And ask a trusted partner. This is what we are here for, and in order to help you put in what good looks like. And Cate, I don't know if you want to add anything to that.
No, that was very well said, Dave.
All right. Do we have anything else, Monica?
I think that's all the questions. So thank you, Dave and Cate, so much for the discussion today. We really appreciate your time. And as we wrap up today's session, I want to invite everybody to join us next Wednesday, July 22nd, for the capstone session of our AI series. Our final discussion, Who Defines Trustworthy AI, brings together an exceptional panel featuring Baxter Lee, our president, Brenton Hill, head of operations and general counsel at CHI, and Julie Chua, director of the Applied Cybersecurity Division at NIST. So healthcare organizations have moved beyond simply exploring AI. Now they're deploying it across clinical, operational, and administrative environments. So the challenge is no longer whether to use AI, but how to ensure it's implemented responsibly, governed effectively, and trusted by clinicians, patients, regulators, and leadership. So in this interactive panel, our experts will discuss where healthcare stands today, the emerging governance frameworks like CHI and NIST, what responsible AI looks like in day-to-day operations, and how organizations can build these governance programs that support innovation while managing risks. They'll also share practical advice on preparing for these evolving expectations from regulators, boards, and patients, followed by our live Q&A. So if you've attended any session in our AI series, you won't want to miss the finale. It's a perfect opportunity to bring everything together that we've been learning and hear directly from the leaders helping shape the future of trustworthy AI in healthcare. So we hope you'll join us next Wednesday, same time, same day, but fresh perspectives. Thanks, everybody, and take care.